Hello, everyone, and welcome to our presentation. I'm Kendall,
And I'm Jacob.
and we did our assessment on the Movement Assessment Battery for Children, also known as the Movement ABC Second Edition.
So the authors of this assessment are Sheila Henderson, David Sugden, and Anna Barnett. The publisher is Pearson Clinical, and it costs about $1,150 to purchase. The kit includes the full assessment battery, including all the tools necessary for the testing, record forms, the checklist, which we'll talk a little bit more about, and an ecological intervention manual. The manual is based on research and provides a complete guide to helping children with movement difficulties. And Pearson Clinical defines the test as requiring a qualification level of B, which means that not anyone can purchase the test. However, formal training on the assessment is not required in order to administer the test. The MABC-2 identifies, describes, and guides treatment of motor impairments in children. So OTs use this to identify delay in motor development and help them to research and plan intervention programs. The test evaluates fine and motor growth skills. The three performance skill categories are manual dexterity, which is the ability to use your hands in a skillful, coordinated way to grasp and manipulate objects and demonstrate small, precise movements. Ball skills, which can include but are not limited to throwing and catching, dribbling, kicking, and aiming for a target. And static and dynamic balance. Static balance is the ability to balance while stationary, and dynamic balance is the ability to balance while in motion or while switching positions. The checklist that I mentioned assesses self-care skills, recreational skills, and non-motor factors that influence movement. This assessment is used with children who have or are at risk for motor impairments. It's used for children between the ages of 3 and 16 years old, and the test is broken up into 3 age bands. The first is ages 3 to 6. The next, which we're going to be focusing on, is ages 7 to 10, and the final age band is ages 11 to 16. The checklist is used for children aged 5 to 12. Each test is comprised of the same items, but they are administered a little bit differently based on the age range.
The MABC can be administered in a clinical setting, in the home or natural environment, and in a school setting. The duration of the assessment should last between 20 and 40 minutes, but could take longer for a child with significant motor difficulties. Before the administration of assessment begins, it is important to take the child's safety into consideration. Each item of the assessment should be completed in the order that they appear in the manual. This order is the same for all 3 age bands. The order of items to be completed is as follows, and will also be briefly discussed later in the presentation. Assessment begins with manual dexterity, which includes 3 items: placing pegs, threading lace, and drawing trail 2. The next area is aiming and catching, and this includes catching with 2 hands and throwing the beanbag onto a mat. The final area is balance and includes 3 items of 1 board balance, walking heel to toe forwards, and hopping on mats. Each of these items are generally the same for each age band, but are scored and administered differently. In conjunction with the standardized assessment portion, a checklist component is also used and completed by the parents and caregivers or teachers of the child who is between the ages of 5 and 12. Administration of the checklist should take about 10 minutes. The scoring process for this assessment takes place in about 10 steps, and it begins with the demographic data of the child and ends with the completion of the assessment summary and intervention plan. During the administration of the assessment, each item is given a raw data score. Once the assessment is completed, the raw data scores are transferred to the front cover of the record form, where they are then converted to a standard score. If there are 3 or more items marked not observed throughout the assessment, a total score cannot be obtained. Because the primary function of the MABC is to categorize children according to the degree of motor difficulties, a percentile ranking is used. Once all of the scores have been calculated, a child is placed appropriately in the traffic light system. The red zone indicates that a child ranks at or below the 5th percentile and presents with significant motor difficulties. The amber zone indicates that a child ranks between the 6th and 15th percentile and suggests that there are minor motor difficulties and careful monitoring of the child should be administered. The green zone indicates that a child ranks at or above the 16th percentile and does not present with any motor difficulties. The checklist is completed using a ranking system of 3 sections, A, B, and C, but only sections A and B are factored into the total score. It's important to remember that tests don't diagnose, people do. So a single test score should not be used in isolation to make diagnostic or intervention decisions about a child.
So now we're going to talk about some examples of the items you'll see in the assessment. The first here is a pegboard. So the child must place the pegs on the board as quickly as they can using one hand. Each hand is tested with the dominant hand going first, and the pegs can be inserted in any order. The next is a thread board and lace, where the child must thread the lace through the holes in the board as quickly as they can. After that is drawing trails 2, where the child must trace the trail as accurately as possible. Next, we have aiming and catching with 2 hands. This item depends on the age of the child. So children between the age of 7 and 8, the ball must hit the wall and then the ground before it is caught. And for children between the ages of 9 and 10, the ball must be caught without hitting the ground. The next is the beanbag toss. The child must stand 2 meters from the target and toss the beanbag onto the target. Then we have the balance board, where the child must stand on the board with one leg at a time. Each leg is tested. In order for the attempt to be considered successful, the board must not tilt such that a side touches the floor. After that, we have the walking heel to toe. The child must walk 4.5 meters along a line that is on the ground. The heel of the front foot must touch the toes on the rear foot. Finally, we have hopping on mats. The child starts by standing on one foot, and they must hop 5 continuous times and finish in a controlled manner. Each leg is tested.
There are many reasons why an OT would use this assessment. It is a tool that allows OTs to identify delay or impairments in motor development of a child and helps them to research for the future. This assessment includes an intervention manual to help guide treatment planning of interventions appropriately for each child. This assessment can be used in a variety of settings and is easy to administer. It's also very beneficial for screening purposes. An OT might use this assessment because it uses a normative sample to categorize movement difficulties into different levels. This is the end of our presentation. We hope you enjoyed. Thank you.